Eczema is a chronic inflammatory skin condition characterized by dryness and itchiness. Also known as atopic dermatitis, eczema is quite common in children, and it is important to know how to manage this condition as it can have a huge impact on the quality of life of the affected child. In this video, we'll talk about the ways you can help take care of your child's eczema. This is Pediatric Doctor at Home, dedicated to the medical education of parents and caregivers. If you get value from this or any other video in this channel, kindly subscribe. Thank you. Eczema is often seen in children who have asthma, food allergies, and hay fever or allergic rhinitis. What these conditions have in common is a concept called atopy, which refers to the genetic tendency to have an intense immune or allergic response to certain substances like pollen, mold, animal fur, and some foods. Eczema runs in families, and children whose close family members have eczema are more likely to have it as well. The majority of children with eczema will show symptoms by the age of 5 years. The exact cause of eczema is still debated, but studies reveal that people with eczema are deficient in a protein called filaggrin, which is responsible for making a resilient and protective skin barrier. This filaggrin insufficiency combined with abnormal immune responses on the skin cause a disruption of the epidermis or outermost layer of the skin, leading to skin inflammation, inability to retain moisture, poor defense against environmental factors, and increased risk of skin infections. Eczema can appear in any pediatric age group. In infants, it usually starts as small red bumps on the cheeks, forehead, or scalp that may spread to the limbs or trunk, typically on the back of the elbows or front of the knees. The diaper area is not normally affected. In older children and adolescents, there are patches on the neck, the inside of the elbow, wrists, knees, and ankles. Sometimes eczema appears only in specific areas of the body, especially on the hands, eyelids, or lips. A major element of eczema is the flare that happens from time to time, which refers to an acute episode of worsened symptoms. Flares may be triggered by various factors including harsh soaps and skincare products, food and environmental allergies, and even stress. During these flares, the skin becomes intensely itchy, inflamed, and really uncomfortable. Scratching and rubbing unfortunately makes the skin inflammation worse. You may notice a rash, tiny blisters, crusts, wetness, and oozing or bleeding from scratching. Flares vary in intensity and duration. With time, as eczema becomes stable or chronic, the skin appears dry, scaly, and very thick with cracks. For most children, eczema is mild with infrequent flares that go away on their own. But children with moderate to severe eczema normally require treatment. Eczema is considered severe if there is constant itching, if the area of the body affected is extensive, or if the condition significantly affects the child's physical and psychosocial well-being, like causing loss of sleep, anxiety, depression, and excessive self-consciousness due to the appearance of the skin. Generally, diagnosing eczema does not require any specific testing. Because there are so many different kinds of rashes in children, your child's doctor has to inspect the skin and ask questions to make the right diagnosis and recommend the best treatment for your child. Occasionally, lab tests or skin biopsy may be done when the diagnosis is not clear-cut. Eczema cannot be entirely prevented nor cured, but there are steps that can be taken to reduce the risk of flare-ups, and there are medications to cope with the symptoms. It is important to learn as much as possible about the condition and be involved in your child's treatment. The following measures are crucial in the management of children with eczema. Number 1. Maintain a healthy skin regimen that involves adequate hydration. Preventing the skin from getting too dry is an important part of dealing with eczema in children. Use moisturizers and emollients regularly. Moisturizers contain ingredients like glycerin and hyaluronic acid that hydrate or add moisture to the skin's surface. Emollients like petroleum jelly, shea butter, coconut oil are products that can form a film or barrier on the skin's outer layer. They also attract and retain moisture on the skin, helping to keep the skin soft and smooth while supporting healing and repair. Many skin products contain a combination of both moisturizers and emollients and may be purchased as lotions, creams, ointments, or gels. Check the label carefully. Avoid the scented ones because of potential allergic skin sensitization. Use a fragrance-free product instead. It is better to apply these skin products as soon as possible after bathing or hand washing while the skin is still moist. One technique used to provide relief from symptoms and promote healing is the wet wrap therapy. This is a supportive measure to improve skin inflammation in moderate to severe cases of eczema. Here, a generous amount of moisturizer or emollient is applied directly on a slightly damp skin, followed by a layer of wet or moist cloth over the moisturized skin, and then covered with a dry cloth to lock in the moisture. This is then left in place for a specific duration, usually for about a few hours or sometimes overnight as directed. Number 2. Avoid eczema triggers. Identify and stay away from anything that seems to worsen eczema symptoms in your child. You may have to avoid specific foods like dairy products, eggs, and nuts. Also, minimize exposure to allergens and irritants like pet dander, mold, harsh soaps and cleaning products, dry air, and coarse fabrics like wool. Use humidifiers to keep the air in the room moist. Manage stress levels and make sure your child gets enough sleep. Number 3. Use medications. Skin creams and ointments, most of which contain steroids, are used to reduce inflammation and relieve itching during flare-ups. They come in different strengths to be used depending on the severity of your child's eczema. The milder ones can be obtained over the counter, while the more potent ones for severe eczema require a prescription from a healthcare professional. Oral drugs like antihistamines may help relieve the itching, and immunosuppressants, which change the way that the immune system works, may also be prescribed if necessary. Number 4. Be on the lookout for skin infections. Children with eczema are at increased risk of skin infections because of the compromised outer skin layer that is not an effective barrier against irritants, the frequent scratching, which can break the skin, and dryness, which makes the skin prone to cracking. When the skin is broken, bacterial, viral, and fungal organisms are able to penetrate the skin more easily. Staphylococcus aureus is a bacterium that is part of the natural organisms that reside on the skin surface of normal and healthy individuals, and it is a very common cause of skin infections in eczema. Symptoms of bacterial skin infection include increased redness, swelling, pus, oozing, honey-colored crusts, and pain in the affected areas. Herpes simplex virus causes painful skin ulcers and fluid-filled blisters. Fungal infections by Candida, that is yeast, and ringworm can also occur in eczema-affected skin. It is important to observe proper hygiene practices and regular hand washing, and promptly seek medical attention if signs of infection are noticed to minimize the risk of complications. Number 5. Consider mental health support. Get psychological interventions if needed. Studies have shown an association between eczema and anxiety, depression, and thoughts of self-harm, especially in children and adolescents with severe eczema. So do not hesitate to get your child any mental health supports that they need. Number 6. Consult a specialist for refractory cases. Many children with eczema can be initially treated by a general pediatrician or family doctor. However, it may be necessary to refer to a specialist in dermatology or allergy, especially in cases of frequent or severe eczema flares that do not improve despite appropriate treatment. It is possible that the symptoms may be from an undiagnosed allergy or may be due to another condition that is not eczema. These situations may warrant further testing or more severe treatment options like phototherapy and immunotherapy. Thank you very much for watching. I hope you have found the information here helpful. You can share with a parent, caregiver, or friend whom you think will also find it helpful. Don't forget to subscribe while you're at it too. Goodbye for now.